Good afternoon, everyone. Thank you so much for joining us for the Chronic Disease Day 2020 Advocacy Seminar. I am Randy Odebrowski, Chief Operating Officer at Good Days, where I help to ensure the delivery of patient-focused navigation solutions centered on advocacy, access to care, collaboration, and service. I am so glad to be here today with all of you and see the tremendous level of activity that is taking place right now across the country to support this Awareness Day. Good Days is proud to have more than 30 U.S. governors join us to officially proclaim today Chronic Disease Day. Despite the many responsibilities and crises that our country faces, we are heartened to see so many public officials take the time to recognize this day with us. I want to give a special thank you to our proclamation sponsors this year and to all of our United for Charitable Assistance Coalition partners. Your support makes this day possible and makes a tremendous difference in your communities and across the country. Chronic Disease Day brings together state and city governments, national patient advocacy groups, and local communities to share in actionable resources that support the chronic disease community. We promote healthy living so that our healthcare system can better support individuals with unpreventable chronic conditions and invisible illnesses. Sharing your story is such an important part of advocating for change on Capitol Hill. As you likely know from your personal experiences, there are several challenges that have an impact across the chronic disease community. There's definitely need for more research funding and more support for public health programs. There also is a significant access to care challenges that are unique to chronic and rare disease patients. With us today, we have Dane Christensen from the Health and Medicine Council and Jim Romano from Patient Services, Inc., or PSI. Dane and Jim both work closely with Good Days and other chronic disease advocates through United for Charitable Assistance, which is a patient advocacy coalition that I chair. They keep close tabs on legislation and policy and have a tremendous depth of experience mobilizing volunteer advocates to make an impact. They are going to review with us the current situation on Capitol Hill, pressing legislative opportunities, and how we can use our voice during the upcoming congressional recess to advocate for change. The one message that is most important, though, is tell your story. With that, I'll turn it over to Dane and James. We are so glad to have you with us today.
Thanks, Randy.
Jim, do you want to introduce yourself first, and then I'll introduce myself?
Hi, ladies and gentlemen. I am James Romano. I'm the Director of Government Relations for Patient Services Incorporated. Like Good Days, PSI is a national nonprofit organization helping families access their treatments and therapies. I just wanted to say a big thank you to Randy. I want to thank Justin Wilson for organizing all of this today. I'd like to thank a couple of people on my staff, Nathan Thompson and Alan Murphy. Thanks, guys.
And my name is Dane Christensen. I'm Executive Vice President at the Health and Medicine Council. I'm notoriously tech adverse, so I hope that I can do this. I think I succeeded. So hopefully that will be the only delay we have. It's my pleasure to be here with all of you. For those of you who don't know me, the Health and Medicine Council and myself personally represents a variety of chronic disease organizations. This includes what you think of as larger chronic disease organizations like the American Lung Association and the American Liver Foundation, but also rare disease chronic disease patient groups like the U.S. Hereditary Angioedema Association and the Pulmonary Hypertension Association. So what we're going to focus on today is those issues that cut across the chronic disease community in general in research and public health and in coverage and access. So there are some common threads that affect patient communities in general. Many of you are probably advocates for your own individual patient groups, be it pulmonary hypertension or the American Liver Foundation. This is meant to supplement and not supplant anything that those groups are doing. You likely have individual priorities that your communities have been working on this year. We encourage you to continue to do that. What we're going to talk about today is legislation and policy that's affecting chronic disease patients on the macro level, what's affecting the chronic disease community. It's weird that I have to say this is our first virtual day. We do regularly hold briefings on Capitol Hill to raise awareness for Chronic Disease Day. Those briefings are often correspond with congressional meetings in person. The Capitol is closed right now. It's physically closed. I cannot go there. My office is about 2 blocks away. I can't walk in the Senate. But the staff are meeting and Congress is working. So even though the building is closed to visitors, which negates the ability to meet with folks in person, they're still very much accessible. They're still doing the country's business, and they're still working to advance annual priorities. We've all had to kind of adapt to this new normal during COVID. This will be about a 30-minute presentation with a modified Q&A session at the end. And as Randy said, that was a great introduction. The most important thing is tell your story. You do not have to be an expert on civics or government to be an effective advocate, but you do have to make your voice heard, and you are an expert on your own experience. We had a great educational briefing earlier today. We were joined by Dr. Perez Estable, the director of the National Institute on Minority Health and Health Disparities. NIMHD was established by Congress. Dr. Perez Estable mentioned this is their 10th anniversary. So this is the 10th anniversary of NIMHD as an institute at NIH. Before that, it was the National Center on Minority Health and Health Disparities. We were part of the effort to establish the center and the institute. And, just to say where we're at, not everybody thought it was a good idea to have a national center on minority health and health disparities. There were folks who didn't think that that was a good decision or good policy. However, Congress ultimately established the center and then elevated it to an institute. And they did that because the community wanted it. Patient advocates wanted it. Folks that cared about health disparities wanted it, and their voice carried the day. They engaged their members of Congress. They talked about the importance of having a research institute for the country that was dedicated to minority health issues, and now we're celebrating the 10th anniversary of NIMHD. This outreach works. Sharing your story works. Engaging your members of Congress is very important. So what are we going to talk about today? We're going to cover a couple things. It's going to start on a macro level, the broad dynamics of Capitol Hill. Then we're going to go into the, we're going to narrow into the issues specifically impacting the chronic disease community. And we're going to close with talking about how you can do personal outreach this year. It's virtual outreach, so calls, emails, that type of thing, since congressional offices, particularly the ones on Capitol Hill, are not open. So that's a little bit of an overview, and we're just going to jump right into it so we don't take up any more time than you've been planning on. So I do want to focus a little bit on policy and national as opposed to politics. So I think everyone's aware election season is coming up. If you haven't seen the torrent of advertisements, expect them starting in August, which is the ceremonial start. But members of Congress are going to be campaigning, and this is an election year. That being said, though, what we're talking about is substantive policy, not partisan politics, Democrat or Republican proposals, things like that. You likely get probably inundated with Facebook messages or things in your email saying, oppose Nancy Pelosi's drug plan, or tell Mitch McConnell what you really think. That's politics. We're focusing on policy. Anytime something needs to be made into law or policy needs to be made, it's not a question of Democrats beating Republicans or Republicans getting one over on Democrats. What moves forward is narrow, middle-of-the-road proposals that have support from both parties and both chambers. I think if anyone watched Schoolhouse Rock, for a bill to become a law, you got to pass the House, you got to pass the Senate, you got to be signed by the president. So in order to become policy or become a law, it's going to be those proposals that one, there feels a need for urgent action on these are high profile items, and two, have broad bipartisan support. So where does everybody think that this is a good direction? So we're going to be talking today about making your voice heard. There's a lot of important issues out there. We, of course, want Congress to prioritize chronic disease issues so that when they're deciding what they're going to work on later this year, they're going to prioritize these items against many other things that they're also working on. So the overall process is such that right now, Congress is a little bit focused on COVID-19. That's sidelined a lot of other work that was going on, but they are going to be doing a lot of legislative agenda setting and funding agenda setting right now. Then they're going to take a break for election season starting in August. Then they're going to come back in November for what's called a lame duck session, and they're going to decide the final funding levels for all key programs, and they're going to decide what bills they're going to work on this year. So that's a little bit of what's happening on Capitol Hill. So within that context, what is specifically important to the chronic disease community? And there's really two things that have been relevant recently in terms of dynamics on Capitol Hill, and they both affect coverage and access, which are, of course, paramount issues for chronic disease patients. Ever since we have what's called guaranteed issue, saying that you have a right to attain a health plan and no one can stop you from doing that, we've seen a lot of challenges to how people access those treatments. So you might have seen something called a specialty insurance tier, where you're being asked to pay a percentage of your medication's cost instead of a fixed dollar amount. If you have a particularly complicated life-sustaining therapy, this might range in the thousands of dollars under your pharmacy benefit. You might have been subjected to a copay accumulator, where if you got some type of assistance, either from a charity or a copay card, it's not counted to your annual out-of-pocket maximum, so you never hit that limit where you're not paying out of pocket anymore. You might have experienced a step therapy or fail first protocol, where your doctor felt that you needed one treatment and somebody else said, and a bureaucrat, an economist, and an insurance company said, you know what, we'll try this other cheaper stuff first and see how it goes. It can be very devastating if you have a serious condition, or if your doctor's clinical judgment is being undermined. And of course, fourth, you may have had an issue with charitable assistance you received, either premium assistance, copay assistance, some form of assistance being blocked or undermined recently. So when you talk about these issues, there's a North Star that you look to. And for coverage, it's the 4 pillars of patient protection. We're not looking for Democratic proposals or Republican proposals. We're looking for the proposals that most defend and enhance the coverage access benefits for chronic disease patients. And those traditionally have been what are called the 4 pillars of patient protection. And that's what we look to defend and enhance on an annual basis. The first pillar is no lifetime and annual caps on benefits. You can't outspend your coverage and have to pay out of pocket. The second is no pre-existing condition discrimination. You can't be stopped from getting a health plan or charged a different amount because of a condition you have. The third is limiting out-of-pocket costs as much as possible. And the fourth is dependents can stay on family coverage until they're 26. Now, this changed just recently. So for many years, if a child had a chronic illness, they'd turn 18. They probably don't have great employer-provided health care when they turn 18, so the family would get stuck paying a lot of medical bills, and you'd end up in these situations of medical bankruptcy or related challenges. Of course, having dependence on family coverage till 26 mitigates some of those issues, but those are the core coverage things that are critical to the community right now. Drug pricing was also a popular discussion before COVID-19 started being the focus of every healthcare committee. How do we get a handle on this pandemic? How do we respond appropriately? And the key thing with drug pricing is out-of-pocket cost. There's lots of stakeholders in the drug supply chain. There's pharmacy benefit managers, there's specialty pharmacies, there's manufacturers, there's middlemen. You could see a proposal that says, oh, we're going to limit drug costs 20%. Well, if that provision means that they're limiting what someone else is paying for it by 20%. That savings might not be passed on to you at all. You might end up paying more, even if someone else in the supply chain is paying less. So the key thing that we focus on is what are the proposals that lower out-of-pocket costs for patients. Within the drug pricing debate, that's been this bipartisan initiative to rein in what's called surprise medical billing, or stick people when they go out of network without even knowing it and charging them different amounts. So as I mentioned, though, the key thing recently, though, has been the COVID-19 response. As soon as the pandemic has kicked up, this has been all hands on deck for Congress. They've done 4 COVID bills. They're working on a 5th bill right now. And since COVID's a health issue, it has been the primary focus of the healthcare committees on Capitol Hill. So, what have been the political dynamics related to chronic diseases? I just went into this a little bit in the previous slide, so I won't belabor this too much. But what's important right now is that since we have guaranteed issue, we've seen these constant efforts to shift costs back onto patients. So you pay more than your fair share, particularly if you have a chronic disease, which tends to be more expensive than just an acute illness. So it's been this kind of whack-a-mole. Now that you have a health plan, it's how many loopholes come up or restrictions. It's these issues like specialty insurance tiers, addressing copay accumulators, using charitable assistance, and addressing step therapy. So the key thing is clinical judgment preserved? Does you and your doctor get to decide what your care plan is? And are you paying the lowest out-of-pocket cost possible? You're not being stuck with an inappropriately high bill that makes it hard to access your coverage. So, that's the dynamic right now. We're going to, if you've experienced any of these challenges personally, tell your members of Congress about it. It's their job to figure out how to solve these. But as you do your outreach, use your own story. Congress hears from many powerful stakeholders, the insurance lobbies on Capitol Hill, manufacturers on Capitol Hill. But Congress knows that you have a pure self-interest. You are there for yourself. You are an expert on your own healthcare. Telling them that information and doing it through your own personal stories and experiences is very informative for them as they try to decide what to do. They can make many of these healthcare decisions with your input or without it. We prefer they do it with your input, but more important than memorizing bill numbers and figures is telling them your own story and what you've experienced personally. And I will say, members of Congress are particularly in tune this year. The fact that the Capitol is closed means that the staff have a little bit more time to engage with constituents that reach out to them and want to talk. And with the elections pending, they're very, very interested in what you have to say. So how does this overall process work? We're going to talk about funding priorities that are important to the community. We're also going to talk about a couple of bills that are important to the community and, what's going on right now from a process standpoint. So a couple of things that are important. One is at this moment, the Congress is working on the annual spending bills. There are 12 bills that fund the entire federal government. There's a bill for farmers in the Department of Agriculture. There's a bill for the FBI in the Department of Justice. And there's a bill for public health programs, the National Institutes of Health, the Centers for Disease Control and Prevention, the Health Resources and Services Administration. Congress has the power of the purse, and they're deciding how much money goes to each of those priorities. It's a member-driven process. They make those decisions based on what their constituents are interested in. If you live in an area with a military base, you might have a member of Congress who's very interested in defense funding. But of course, since you are part of a community, a chronic disease community that's relatively large, you want to make sure that just like that military base, your members are also sensitive to needing to fund public health programs. These are must-pass bills. They're going to decide in the House and Senate what their allocations are now. They're going to make those decisions heading into the August recess or shortly thereafter. And then when they return from what's called the lame duck session, that's when they're going to get everything done. There's a popular expression, Congress works for crisis or Christmas. They're certainly working for crisis right now. That's the COVID-19 response. They're really engaged. They've done 4 bills. They're doing a 5th bill. For Christmas means they want to get things done at the end of the year, the end of the calendar year, as they're trying to get out of town. They want to finish off all their pending business. They want to must-pass bills. They want to be able to leave because, Congress will end. They will have to go. And then whoever's elected in November will come back the next year, but that's a whole new Congress and the whole process starts over. So they have business that they have to finish this year. They're going to set those priorities right now, both in terms of funding numbers and in terms of what bills they're going to pass. And they're going to come back during the lame duck session session with limited time, and they're going to address those most pressing items. The old expression is you can be at the table or you can be on the menu. If you want to make sure that your members of Congress, your 1 representative and 2 senators are working for you, the only way to do that is to make sure they know your story and they know who you are. They reward folks who reach out to them. They can't go out on their own and try to find out what's important to you. They can only be responsive to the folks who take the time to speak with them about these issues. So what are these issues? There's really 2 categories we're going to talk about today. The first is funding recommendations. So what are the current funding issues, the appropriations issues that are important to the chronic disease community? And there are many, but we're just going to focus on those ones that are broad and apply to everyone. And secondly, what are the current pending legislative requests? And once again, there are many bills that are very important. There's a bill right now called the Metastatic Breast Cancer Access to Care Act. I believe it's HR 2168. That means it was the 2,168th bill introduced. I believe there are over 7,000 bills now. They can't pass all of them. But we do want them to work on some healthcare bills. These are the bills that are broad and tend to impact the entire community, but it's important when they decide how they're going to spend those limited time resources at the end of the year. What are the most important initiatives out of those 7,000 bills that are pending? And then once again, the most important thing about all this is just taking the opportunity to connect with your congressional offices and tell them your story. What condition are you affected with? How has it impacted you and your family? What has your healthcare journey been? Has someone like a Good Days or PSI helped you? And in what way has that mattered to you and your family? So what are the funding requests that are most important to the community right now, or broad enough for the entire community? The first is the National Institutes of Health. NIH is the world's foremost biomedical research enterprise. If you've ever watched 60 Minutes or another news show and seen a breakthrough, a mechanical arm that someone who's paralyzed can control with brainwaves, or a brand new therapy for metastatic cancer, whether that research was done at MIT or at UT Southwestern, it was likely funded by the National Institutes of Health. That money doesn't stay in Washington. That money goes out to academic health centers across the country to support their research. Doctors compete for it on what's called a peer-reviewed basis. Of course, if you want more research and more progress, you need more funding. There are a lot of chronic diseases. NIH funds research into all of them. If you want your slice of the pie to get bigger, the overall pie needs to get bigger. So the entire community right now is asking Congress to provide NIH with a $3 billion increase to bring total funding up to $44.7 annually. We asked Congress for a $3 billion increase last year. They gave $2.6 billion. I would say if it's not broke, don't fix it. So everyone's asking for $3 billion again and hoping for a similar result. Hopefully they provide the $3 billion. But it's incredibly important that they continue to advance chronic disease research so we make scientific breakthroughs, we lower healthcare costs through innovation, and we make sure that patients have more treatment options, particularly for these conditions that don't have great or any existing treatment options. The second request is a little bit more limited to the chronic disease community at the CDC. CDC has something called the National Center on Chronic Disease Prevention and Health Promotion. That center, though, only funds research into conditions that have line item spending. So unlike the NIH, which is doing research into everything, the CDC will only do public health activities where they have line item spending from Congress. It says you're going to spend $2 million on smoking prevention. That's what they do. They don't just do work on everything. Congress very closely ties their budget. What the community is asking for, and this is something that the House provided last year, but not the Senate. The hope is this year it will get over the goal line with support from both. The community wants $5 million in dedicated funding for a chronic disease education and awareness program at CDC. This is to hand out cooperative agreements to various nonprofit organizations to allow them to work with the CDC as if there was line item funding to do public awareness, surveillance activities, professional education, and overall public health. This is a pot of money that would be discretionary for the CDC. Folks would put in their best applications and they would be able to fund public health initiatives with a number of groups. There is no way for them to do this right now unless someone provides line item funding and rolls it over on an annual basis. This pot of money will allow many more communities to collaborate with the CDC on timely public health issues. And it'll give the public health experts at CDC resources to say, geez, this is what's really emerging or ongoing, and this is what we need to work on this year. So great way to advance stakeholder relationships. There are two bills that are also very important. We want them to prioritize these when they come back for the lame duck session. The first one to talk about is the Safe Step Act. This bill is bipartisan. It has support from Democrats and Republicans, and it has a bill in the House and the Senate. In the House, it's HR 2279. In the Senate, it's S2546. All you got to do is ask your House members to co-sponsor the House bill, your Senate members to co-sponsor the Senate bill. If they're already a co-sponsor and you ask, they're just going to be glad to tell you we're already on, and they get to say thank you. So they want to know, especially even if you appreciate the fact that they're supportive. But we need more co-sponsors if this bill is going to move forward. So the Safe Step Act is meant to rein in the worst parts of step therapy protocols, that are undermining clinical judgment and disturbing the doctor-patient relationship. This does not ban step therapy, but it puts important guardrails in place. So what happens is, if an insurance company is going to switch you off a medication that your doctor prescribed, this allows you and your doctor to have a right to know that that's happening. You don't just show up at the pharmacy counter and all of a sudden you have something different and it's got a weird name and you're not even sure what happened. The second thing, which is very important, is it gives your doctor a chance to appeal the decision. The doctor can say, no, I'm the expert on treating this particular condition. I know that what I prescribed is right for whatever reason, and I want us to do that. So, that's particularly crucial when you have some of these personalized medicines or conditions that are sensitive, and it takes a doctor who really knows the patient to figure out what the best course of action is. The other bill is the Access to Charitable Assistance Act. This is meant to deal with the harsh abuses of insurers denying patients access to charitable assistance. I remember a few years ago, there were 13 hereditary angioedema patients in Louisiana that got notified that since someone helped them pay their medical bills, their policies were being canceled. This bill also deals with copay accumulators. So the abuse of saying if someone provided you with some form of help, we're not going to count that to your out-of-pocket maximum. I'm going to hand things over to Jim Romano, who's going to give us a 90-second primer on what's going on right now with the Access to Charitable Assistance Act. This bill was very popular in the last Congress. It had over 175 bipartisan House co-sponsors. It's going to be reintroduced in this Congress, but it's got some modifications to update it to where we're at right now. But Jim's going to give us a status update on that bill.
Thank you, Dane. So last Congress, we had the Access to Marketplace Insurance Act. We have, because of a lot of feedback we received from a lot of the patient groups and patient assistance groups, and to take into account the regulatory environment that we're living in, PSI has worked with Good Days, and we've worked with the Hereditary Angioedema Association, the Pulmonary Hypertension Association, to start building a framework to get a safe harbor / HHS regulation for patient assistance programs. So we've enhanced the legislation, and right now is with Senator Kevin Cramer of North Dakota. Last Congress, he was Congressman Kevin Cramer. Now he is Senator Kevin Cramer from North Dakota, and we are looking for a Democrat and looking to move this forward. However, we're also at this point looking to see how we can use the current COVID landscape to try to get some temporary relief on this third-party payment issue. About 6 years ago, when the rule came out, it was very focused on allowing government entities to be able to pay premiums, but allowing the insurance companies to reject third-party payments from nonprofits. And we have been fighting ever since then. Now, at the time of a national emergency, PSI and UCA and Good Days are really trying to push to make sure that for the national emergency, we will be able to pay these premiums for basically a short period of time. I'll be talking about this more at the end. But we're working now to get a lot of the kinks ironed out in legislation, and to have it either introduced in this Congress or first thing next Congress. So with that, I'm going to throw it back to my good buddy, Dane Christensen.
Thank you, Jim.
Flying an airplane or something.
So the rule that came out a few years ago saying that insurance companies can decide how patients pay their medical bills, and rejecting support from many people who help them pay, distant relatives, neighbors, professional charities, other stakeholders, that rule never fit. And it's even more pronounced now when you have something like COVID, which is a serious issue for many patients and likely will carry high unemployment and other financial challenges along with the current situation. So what we're asking for is both for members of Congress that want to be initial co-sponsors or join this effort again. And we're also asking Congress if they'll provide temporary relief through the ongoing COVID-19 response. I think at least for the COVID-19 period, you have to allow charities to help people with their bills, particularly if they have a serious or chronic illness and they may be facing a difficult financial situation. So the key thing you just need to tell them is we need you to stand up for charitable assistance. We need you to support the community on charitable assistance. So how do you do timely congressional outreach, particularly when everyone is teleworking or remote working? We do have information that you can receive if you want a draft script and call to action along with the legislative agenda. You can always just read the legislative agenda if you're talking to an office. There's no demerits for that. It actually makes it very easy on the staff if you relay it to them exactly. The most important thing, as Randy mentioned, is telling your story. Then the legislative details are a little less important. If you want those legislative details, though, we are going to send them to you. If you RSVP'd for the event ahead of time, Jackson will send you the information next week. Justin can also get the information to you. There's 2 email addresses that you can use if you want to have that information emailed to you to help with your outreach. The first is info@mygooddays.org. The second is my colleague Jackson's email address. I'm using his because his name is very short, so his email is very easy. That's rau@hmcw.org. So rau, R-A-U, at HMCW, Hotel Michael Charlie Whiskey.org. And we can probably put that in the text box also for anyone who's using the text feature during the presentation. We want you to engage your representative and your 2 senators at the end of July and moving into the August recess as they're making these key decisions. And you can conduct this information the way that you feel most comfortable. You can email the office, you can call the office, you can try to set up a local meeting with social distancing if they're doing that. You can try to set up a telecall with the office or the health staff, and you can do it at whatever time works for you. They tend to be open Monday through Friday, 9 to 5. You can schedule it for your lunch break. You can schedule it for after or before work. If you you can schedule it whenever you want if you're social distancing or working from home. But the difference is, unlike an event on Capitol Hill where you have to be somewhere at a certain time and you have one day to do this and you got to make a flight out, you can do this anytime that works for you over the whole month of August. The important thing is that these offices hear from many different patients and get a good sense of what the community is asking for. So you might be saying to yourself, how do I find out how to contact my member of Congress? Your House member is easy to get to. They're at house.gov. So if you go to house.gov, not .com or .org, this is a professional website for the U.S. government. You go to house.gov, you see in the upper right-hand corner, it says find your representative. You just put your zip code in and you hit look up. It takes you right to their website. Their website's going to have their DC phone number. It's a 202 number. They're going to have local numbers. They maybe have an email contact you can use. And they might even have a web form where you can just send them the information you're looking for ahead of time. You can call them and ask to set up a meeting. You can call and ask to talk to the Health LA, which is the staffer who handles health. You can ask for their email address if you want to email them. But the key thing is to get a little bit comfortable with the idea of reaching out to the office when you want to talk to them. On the Senate side, you have 2 senators. So you go to senate.gov. If you click on the Senators tab, the first thing that will pop up on that drop-down menu is Contact. Senators are done by state. So if you're from Arkansas, you just click on Arkansas and it will immediately show you the pages for your 2 senators. And much like the House pages, they will have the DC office contact information. You can call the 202 number. They may have an online contact form. You can always call and ask who the Health LA is and ask for their email address. They might have a web portal to send an email, but your web pages for these members will have their information. And I'm not so social media savvy, but these days you can probably go to a Facebook page or a similar page and say, hey, I'd appreciate the chance to talk to you. I'm a constituent, and work it out from there. So that's all we've got. If those of you who know me or have done meetings with me before know that I tend to go over my time a little bit. I think we only went slightly past this time, but I thank everyone for their patience. I hope this was helpful. And we are going to do a couple of questions. So Justin, do you want me to leave my screen up, or do you want me to stop sharing and go back to the main page?
You're finding you
Yeah,
have
Dave, I think you're good.
notes are up.
Well, Dane and James, thank you again for the excellent informative presentation. We have some time for some questions, so I'll start shooting them at you guys and take your best stab at answering them.
We'll do our
First, we
best.
have, what is the status of the third-party payer legislation?
Well, thank you. I wanted to get into this. I have some really great news. So with the COVID packages going through Capitol Hill, we've been told that there could be a possibility to put some third-party payer provisions into the next COVID package that's going through the Senate. And we work with Senator Kramer to get a provision put together, a timely provision that would help. It would protect nonprofit organizations like Good Days and PSI and the other nonprofits out there to be able to pay premiums. It'd be for a set time period. So I would like to tell everybody who's following us to contact Jackson or contact Good Days about working together. We're going to need help contacting the United States Senate, asking their senators to support the Kramer provision for the next COVID bill. And we can work with them, as Dane was saying earlier, we can work with them to get the appointment, to get the message into the Senate offices. So it's very important that you contact us and we'll work with you because we're going to need your help, because I think there's a really good chance that we could, with a lot of grassroots support, get some kind of, I would say, temporary expansion to the end of the national emergency.
Perfect. All right, you guys ready for the second one?
Sure.
All right. I am not a fan of my member of Congress. Should I still reach out to them?
That's a very good question.
Yes.
As I mentioned, this is not really about Democratic politics or Republican politics or independent politics. This is about policy and making your voice heard with your members of Congress. Campaign offices, the political side of things, tend to be very separate from congressional offices where policy staff work. And that's done intentionally. There's a separation between campaigning and between making policy. So your member of Congress probably doesn't know who you voted for. They don't know what your politics are. And this isn't the kind of conversation for that. You're not going to call them up and say, geez, I don't like what you've done and I really hope you lose. By the way, here's some things I want help with. I mean, you're here to represent the chronic disease community. That's who we're talking about. You're here to ask them for their support on these issues. As Jim just noted, the key thing is we want to build a critical mass of support by having champions from across the country and across the political spectrum so that any of these ideas can prevail and these issues always move forward. Even using charitable assistance as an example, because we were just talking about it, one of the most common things that I get when I'm talking to staffers, even staffers who work on health policy or on a healthcare committee, is they're not so familiar with what charitable assistance is or how it works. So they're not out looking for ways to fix these problems they might not even be aware of. They need you to tell them what's going on with you personally, and you need to ask them for their help and say, here's some things you can do, like the Kramer Amendment, that will help us out. Political ideology and who did what to who or what about this shouldn't even enter into that discussion. The discussion is you and the health policy staff for your congressperson or the congressperson directly, telling them your story, explaining why chronic disease advocacy is important to you, and asking for their help. And we're going to have a lot of folks that are retiring this year. We're going to have a big election. So the person that you don't like might not be back next year. And even though you took the time to reach out this year, we would hope that you would take the time to reach out next year and educate the next person who's in that seat. We're going to need them to be a champion too. So it's really not so much about the politics or about things that have been done. It's more about making sure that you're engaged in the political process. So whoever your representative is has the opportunity to be responsive to you. Of course, if they say, gee, thanks for reaching out, I don't think I'm going to do much, then, don't vote for them in November.
I have two really great stories, if you don't mind me telling them. So when I was in high school, I worked on the campaign against the congressperson. And then he got elected and I had an issue. And so I scheduled a meeting to go meet with him with zero expectation. It was also the day of my girlfriend's prom, and I had to show up for the meeting, and it was late afternoon in my tuxedo, which was another kind of funny story. But my point is here, I didn't expect much. I went in and asked for his help, and he said, I'll absolutely co-sponsor your bill. I'm really glad to hear about young people being involved. And so I gained a different perspective. While I didn't agree with him totally politically, I could go to him with issues. Second good story is when I was working on Capitol Hill, my boss was a Democrat, and the head of the county in the congressional district that she was, the head of the Republican Party, wanted to get his medals from World War II. And he had gone to the other congressional districts around because his congressperson was a Democrat and he was the head of the Republican Party. And the others wouldn't help him. And so finally, in desperation, wanting to get his World War II medals, he came to Cynthia, my boss, and said, "Would you help me?" And she's like, "Sure, I'll put the paperwork in, not a big deal." And so here, the guy who's the head of the party against her, she helped get his World War II medals to him. So they're there to serve. And actually, even if you don't agree with them, maybe if you met them, you can either change their minds or you can at least develop an appreciation for them. Just two stories.
Thanks for sharing those, Jim. Those are good ones. We always talk about here at Good Days, people helping people, and that's just kind of another example of that. I mean, it doesn't matter who you are, where you come from. At times we need help, and it's part of our obligation, our mission, and what we do every day to help people where we can. All right, guys, let's do one more, and then I think we can wrap it up. Let's go with this one. If a big part of being effective is telling your story, as we've talked about today, should I still reach out if I am not a chronic disease patient?
This comes up a lot and across many communities, and I'm glad that it came up today too. I should have mentioned this earlier, but when it comes to telling your story, you don't necessarily need to be telling a chronic disease story that is personal. If you are a family member, if you are a friend, if you are a caregiver, if you're just someone who thinks Chronic Disease Day is a good idea, your outreach is incredibly valuable. And the fact that you care enough to call the office and advocate means a lot to them. So they know that, on most issues, most people aren't picking up the phone and talking to their member of Congress. The fact that you took the time to do that is incredibly important and means a great deal to the congressional offices. It doesn't necessarily need to be the case that you have an illness or that you are personally doing something. If you've seen, one of the folks that I'll always remember was the neighbor of someone who had a serious chronic illness, and they couldn't believe what this woman had experienced at the hands of, just discriminatory policies, struggles with insurance as she dealt with a terrible illness. And he said, she doesn't know that I'm doing this, but I want to reach out to our members of Congress and tell them to help. And that means a great deal. So you don't have to necessarily be personally effective. Your story is still incredibly important. Even if you're just doing this on behalf of the community, tell them that you're a community advocate and tell them why you care. Your personal story has value, whether it's a chronic disease journey or not.
I mean, that's how I got started in this. Get started in this business, but my uncles had hemophilia. I was personally not affected, and watching, helping with their care, with my one uncle's care, and taking him to doctor's appointments and such, gave me a very sense of we have to do something to fix this, or at least call attention to it. And so I became a advocate, through personal family stories, although I wasn't personally affected with it. So they love to hear from family members, friends, and just think everyone who, if you have the disorder, everyone around you that you touch can be an advocate for you. And I think people want to do that. And so you just have to ask them, or sometimes they volunteer.
Your network on Facebook or social media, anyone can help.
Mm-hmm. When you're not yelling about politics.
All right, guys. Well, thank you again for your time, Jim and Dane. It's been a very informative discussion. And I want to thank everyone again for joining us for this Chronic Disease Day. I think as we've learned today, and we continue to learn, we can all make a difference to advance legislation that supports access to care for people with chronic and rare conditions. We hope you will continue to advocate with us. Thank you again. Have a great rest of your day and enjoy your weekend. Be safe and God bless.